tell me if this doesn't look familiar. One day you're hurting pretty bad, so you take your go-to over-the-counter pills, whether it's Aleve, Tylenol, Motrin, aspirin, or some type of natural product, or you may be inclined to use some type of topical product like a Voltaren, a Icy Hot Biofreeze, or maybe even Tiger Balm. But since you don't get the relief that you were hoping for, you go to your doctor's office, you tell him of your knee, your back, your neck, your hip, or shoulder pain, and he offers to write you a prescription, perhaps a stronger dose of pain pill, or perhaps an anti-inflammatory prescription. You try it, but still, it's just not getting the job done. So you make another appointment, tell him how the pain is just not going away, and then he offers to give you a cortisone or steroid injection for your knee, your back, your hip, neck, shoulder, whatever it might be. You then notice for a few months, perhaps even longer, you were feeling pretty good, but then it started to wear off. So you go back and get another injection. But unfortunately, this second injection did not last as long as the first. So you go back again, hoping things will last longer. But unfortunately, you're disappointed that it lasted even less than you had hoped. So now the doc tells you that you should try some physical therapy 3 times a week for maybe 6, 8, maybe 10 weeks and see how that goes. So you go through the therapy and you notice that either you felt good while you were going through it, but when it ended, the pain started to come back again, or as you were trying the therapy, you actually started to feel worse. Either way, you end up going back to the doctor again, and this time he tells you he wants you to see a surgeon. So you make an appointment with the surgeon, but it's a couple months before you can see him. Meanwhile, your neighbor knows that you're hurting and tells you to check out their chiropractor. Another friend tells you about the acupuncturist, but notice again that while you're under care, you feel better, but the pain comes right back. Finally, you get in to see the surgeon. He tells you that they do these surgeries all the time. It's no big deal. You come in the morning, we'll be done by noon. I'll have you stay here for a few nights and then you'll be home, no problem. Then I'll send somebody over to your house, do some therapy for a few weeks, and after that, you'll go to rehab for another 12 weeks, maybe 3 times a week. Now, that is the traditional medical approach to chronic pain. So you're watching this video because you need to get rid of the pain and suffering. You want to avoid perhaps using a cane, a walker, or a wheelchair. Maybe you're getting near retirement. You want to enjoy yourself. You want to play with the grandkids, go golfing, bowling, go for a hike, participate in family functions, do some chores around the house without hurting. Maybe your sleep is being deprived. Maybe you just want to avoid surgery. Maybe you want to remain independent and not become dependent upon others. So let's take a look at the parts that make up the joints of the body. When we look at the bones of the body, whether it's the neck, the shoulders, the back, the hips, the knees, you'll notice that the bones actually do not interlock with one another. We have to have muscles, tendons, and ligaments that attach to the bones in each other so that the bones can then move, and that's what creates the human body. So it's the bones as well as the muscles, tendons, and ligaments that make up the joints of the body. If we look at the degeneration process, you have to understand that a healthy joint has a separation between the bones, which again is maintained by the muscles, the tendons, and the ligaments. But when the muscles, tendons, and ligaments are no longer able to keep the joints stable, you're going to notice periodic pain, maybe some loss of motion, maybe even loss of strength. And if this is not corrected in time, then what we start to see is some destruction of the joint. And if it continues where, you did not receive the appropriate care of the muscles, the tendons, and the ligaments, if they remain ineffective in keeping the bones of the joint stable, now you're going to have more often, you're going to see where you have increased loss of motion, increased loss of strength, and more frequent pain. And now you notice that the bones, they're starting to get closer and closer together. And again, the longer this continues, then eventually you will end up as being bone on bone. So the 2 areas to address with chronic joint pain are, number 1, are the muscles, tendons, ligaments keeping the joint stable? Is there a loss of range of motion? Is there a loss of strength of the joint? Is there pain in the joint or pain upon using the joint? And number two is how much space is left in the joint? Well, we could take an x-ray. That's pretty simple and easy, right? So we want to know, is there a loss of joint space? How much arthritis or degeneration or bone on bone shows up on the x-ray? That's important because most of the people we see here at Michigan Integrative Health, they are in fact bone on bone. So ask yourself, do the over-the-counter or prescription drugs stabilize the joint as well as heal and repair the tissues? Does the cortisone or steroid injections stabilize the joint as well as heal and repair? Does physical therapy, even though it may strengthen muscles, but does it repair and heal? And if you continue this process, you need to ask yourself, where are you going to be 6 months, 2 years, say 5 years down the road? Well, more than likely, if you stay on this path, you are going to be headed towards surgery. Hi, I'm Dr. Roy Picard, DC with Michigan Integrative Health. And our office is comprised of a medical doctor, nurse practitioners, chiropractors, and medical assistants. And the office is located in Shelby Township, Michigan. Our office is unique because, number one, we don't use drugs or surgery. The care that is required is going to be between 1 and 4 visits, and the visits can be 2 to 8 weeks apart. We provide services that get to the cause. They increase the ability of the muscles, tendons, and ligaments to stabilize the joint, and we use a process that we'll talk about in a little bit called myoneural rehabilitation. And the other thing that we do that is unusual, or you can say unique, is that our care is all geared to helping to heal and repair the joint. So we have regenerative medicine injections of natural substances. Now, when it comes to the myoneural rehabilitation, let me explain this to you. It's a hands-on procedure involving the muscles of the joint. It is not a manipulation, a chiropractic adjustment, or massage, and it's used to stabilize the joint. It increases motion and strength. It decreases or eliminates pain associated with the knee, back, hip, or shoulder. And it takes about 1 to 3 sessions that are required. And one session will often outperform months of traditional physical therapy. Our validation test determines if you will benefit from this care. And keep in mind that your body produces healing substances. It produces cytokines, growth factors, proteins, mesenchymal stem cells, exosomes, and microvesicles, and these are all used to heal and repair tissues of the body and the joints, the muscles, tendons, and ligaments. And we know that it's effective for arthritic, degenerative, bone-on-bone joints of the body to help heal and repair. So the good news is we know our body can produce these substances that help to heal and repair. But unfortunately, our immune system declines as we age and our body needs help to heal and repair, or I should say regenerate. And what we see is that as we get older, the body just loses the ability to produce those substances as it did when we were a young infant, as we were developing to grow. What we offer is regenerative medicine for degenerated, arthritic, bone-on-bone joints. And these are injections with the purpose of healing and repairing damaged tissue. We do not use cortisone, hyaluronic acid, gel shots, or any drugs or medicine. We have multiple products that contain one or more of the following: cytokines, growth factors, proteins, mesenchymal stem cells, exosomes, and microvesicles. With regenerative medicine, the injections are not just about supplying the area with healing and repairing substances, but these injections actually increase the signaling of your immune system to perpetuate healing and repair, or what we call regeneration. There's multiple types or kinds of injections that are available depending upon the condition of the joint, the amount of degeneration or arthritis or bone on bone, and the age of the patient. Some of our products come from umbilical cords of full-term healthy moms and babies. These do not contain blood. They're tested for the viruses that are of recent as well as past. These are immune system neutral products, so anyone can use these. It has nothing to do with blood type. The process of C-section to umbilical cord preservation to tissue labs to being shipped out to our office, they must all follow the guidelines from the FDA, the National Institutes of Health, the American Association of Tissue Banks, and the American Association of Blood Banks. And we've been using these products since 2017. The specific care that you will benefit from is actually determined during our consultation and screening process. During our consultation and screening process, 90% of patients notice an immediate improvement in strength, range of motion, stability, and a decrease or elimination of pain during our myoneural validation test. People who have knee pain, they come to us complaining of bursitis, tears of the ACL, strains and sprains, meniscus tears, osteoarthritis, and bone on bone. The x-ray on the left actually shows you what a normal knee should look like. There's no bone on bone with this situation. There's plenty of space between the two bones. But when you look on the x-ray to the right, you can see on the left-hand side or the inside of this knee, that's where this individual was bone on bone. When it comes to back pain patients come to us complaining of bulging discs, herniated discs, stenosis, osteoarthritis, degenerative joint disease, degenerative disc disease, and bone on bone. Again, the x-ray on the left is a normal x-ray. There's plenty of space between the bones of the back. The one on the right is actually somebody who came in here after they had surgery. You can see some of the rods and screws, and they still ended up having arthritis, which is actually now bone on bone just above the surgery. They received our care. They did very well. When it comes to people with hip pain, they often complain of bursitis, labral tears, osteoarthritis, and bone on bone. Again, our procedure is such that we need to take an x-ray. We need to see how much space is between the bones of the joint. The x-ray on the left shows normal spacing. The one on the right actually is really not showing any space at all. And there are some people, about maybe 5-10% of the patients that we see, that it's so far gone that we can't do anything for them. So this person was refused care. Most of the people, however, we see are bone on bone, and they do receive our care. With shoulder pain patients, they come to us complaining of bursitis, strain, sprain, rotator cuff tears, osteoarthritis, as well as being bone on bone. Here at Michigan Integrative Health, it all starts with our consultation and screening process. The consultation, which we normally charge $60, it is a discussion of your medical history, previous care you had, as well as reviewing your current and past use of medications. We include the x-rays of the areas involved, whether it's your knee, your back, your hip, your shoulder, your neck. We're going to review your expectations, and then we're going to compare the x-rays, how much arthritis, how much degeneration, how much bone on bone, to your expectations, just to make sure that they match up. On that same visit, we also do the screening process, and that's where we assess the range of motion, the functional pain assessment, we do the myoneural validation testing, we discuss the reasonable expectations from care based on your specific results and findings, and we determine if you're accepted for care. At that point in time, then we can have a discussion of the myoneural care. We discuss the regenerative medicine joint injections, and we discuss the specific types of injections, and we'll lay out the cost of care for the cash discounted fee, as well as through financing options, where as long as you can comfortably fit $200 into your monthly budget, you will have no problem at all affording our care. We're going to answer all your questions at that time, and our normal fee for the consultation and screening is $310. During our discussion, we need to understand, do your expectations match up with the amount of arthritis and degeneration, or let's say bone on bone, that you have? Are your expectations realistic? Are you expecting to grow, let's say, a brand new body part from the injections? Because that's not how this works. We're here to help you to be able to, say, improve your quality and quantity of sleep, get through the day without pain, or at least drastically reduce it, and to help you to be able to enjoy your family, your friends, and activities that were previously limited. Now, I'm going to show you what happens in our office. Again, when you come in for the screening, we have what we call is the myoneural validation test. And this is where we evaluate your pain level, the range of motion, and the strength before we actually do the test. You'll receive the test, and then we reevaluate your pain level, the range of motion or strength test, And again, 90% of the time, we see an immediate improvement. What you're going to see right now is a lady who came to see us. She drove about 2 hours. She suffered with really bad knee pain. You're going to see the process right now. So when she comes in, the first thing you will see is that we're going to have her walk back and forth across the office. She'll go up and down the stairs, and she'll comment on how she's feeling. Then immediately after that, she will receive the test, and then we'll have her repeat that process of walking and going up and down the stairs. This way you can hear how her response is. And by the way, her response, as well as the one following immediately after, is not an exception to the rule, but this is what we normally see in our office. So right after her, you're going to see a gentleman who had difficulty where he could not raise his hands higher than what you'll see on the video. He receives the validation test, and then you're going to see for the first time in years his ability to raise his arms higher than he has been. So let's take a look at this. Before, what level of pain are you at right now?
Well, right now it's only about 2.
Okay, that's fine.
3, maybe 3.
So between 2 and 3.
Yeah.
That's fine. You can turn back this way. Let me know. Keep walking.
Do you see me wave?
Yeah, you're unstable for sure.
Yeah.
You go ahead and keep walking. What level are we at? We're still at a 3 roughly?
Yeah. Maybe a little more. 3.5.
You're about a 3.5?
Yeah.
Okay. Now what I'm going to do is this. We're going to go out. We're going to have you walk the stairs. Okay. And just give me some feedback on a scale of 0 to 10. What level of pain are you at?
I am going to say 5.
Okay. And then you carefully turn around, come back up. And you are definitely using these rails.
Oh, yes. Coming up,
What
definitely.
level of pain are you at?
I would say 6.
You're at a 6 right now.
Yeah.
Walk towards. All right, she just received the test right now, so let's see her response. What do you notice?
It's not aching like it was. Like
When
as
we-
I'm taking steps, it's not
Yeah. Before
pressure
you
feel.
were at what level?
Before?
Yeah.
What was I, what did I say, 3, 3.5 or something?
3.5, right around there.
Yeah.
Then after the steps, you were at what level?
Oh, 5.5,
I
6.
think you said about 6. All right. So
Yeah.
let's check the steps and see how does that feel?
A little bit crunchy,
Yeah.
but not as bad as what it was.
You didn't have as much pressure on the rails when you went down?
I never
The
do.
first time. Okay. Come on up.
Oh, I see what you're saying. I thought you meant between up and down. Oh, this is great.
What level is that?
Maybe 1.5 or 2.
And it was what before?
Too much.
It was like 5.5, 6.
5.5, 6, yeah.
Awesome. Arms up as high as they go. That's pretty much it right there. Relax, I got you. Okay, let your arms go down. Have a seat right here. Is this still recording? Okay, that's fine. As you did before, with your hands facing each wall, both at the same time, lift them up as high as they go, please. All the way up to the ceiling, as high as they go. Is it a little bit easier than last time?
Oh yeah, and more up.
Oh yeah, absolutely, by about 90 degrees on each side. Very good. Does insurance cover the regenerative medicine injections or the myoneural rehabilitation? Well, we can tell you this. Insurance covers traditional medical care, the pills, the steroid injections, the physical therapy, and the surgery. Our consultation and screening tells us if you qualify for care and which specific care is necessary to heal, repair, and get you out of pain. The investment into the program is going to be determined by what body part is being treated, your response during the myoneural validation test, and what type of injection you require. Cases involving the knee, hip, or shoulder will be in the $1,200 to $4,260 US cash discounted fee range. A neck or back problem will be in the $1,600 to $6,840 US cash discounted fee range. And for those with multiple joint problems, we do offer a substantial discount. The fees do not double for 2 joints or triple for 3. And we do work with a number of different financing companies so that those who have decent credit can receive care paying $200 a month US. And something to consider is that many people are surprised that they still end up paying for some of their surgery even though they have insurance coverage. Our care does not require months of physical therapy, say 3 times a week. Our care does not require weeks and months off of work. And our care could cost as much as what many spend at Starbucks for 6 months. Now with chronic pain, we've already discussed the physical problems, but one thing to consider also is the emotional component. And if you're watching this video, hopefully you're watching with a spouse or a loved one or someone who can assist you in your healthcare decisions. But for them, they need to understand when you're dealing with chronic pain, it changes everything. Not just how you physically behave, but your ability to be kind to others, let's say. Your demeanor, you can get depressed. You can be snippy at times, but you have to understand this is what happens when your life is being taken away from you and you can't function and do the things that you should and deserve to do. This woman right here has an amazing story, but also pay attention to how her life changes. And she demonstrates that with her attitude as she tells her story.
Okay, can you tell me your name, please?
Linda,
Linda, where are you from?
Amherstburg, Ontario.
And Linda, tell me now, what kind of problems were you having before you came here?
I had severe pain with arthritis in my knees, everywhere, my arms, my hips, my back, and mostly my knee was why I came, because of the pain that was so bad, giving me trouble walking, sleeping, doing household chores, everything.
Okay, and what were you diagnosed with?
Osteoarthritis.
Okay, and like how bad was it? Was it like, did they call it a certain name or anything, or was it, you know?
Oh, I was bone on bone, he said.
Oh, you were bone on bone?
Yeah.
Okay. And then what was your quality of life then?
Wasn't much, because I couldn't do too much of anything. The pain was so severe that I'd walk a few steps, then I'd have to stop and sit if I had, or else I'd sit on my walker, or if there was a bench nearby or something when I was out shopping and stuff. Wasn't sleeping, so I was being tired all the time.
What kind of sleep were you getting at nighttime? Like how long would it last?
Maybe 3 hours maximum, and then that was interrupted with the pain, also having to toss and turn and relocate to try to get the pain gone.
So life was kind of rough then?
It was hard.
How were you able to, let's say, like do yard work and stuff like that?
I didn't do anything. My sister and her husband always did everything for me.
Okay.
My sister even did the house cleaning for me, everything.
Wow. Well, you're lucky to have a sister like that.
I am.
That's for sure. And you were taking quite a bit of medication at that time?
Lots of stuff.
Lots of stuff. How was your disposition, would you say? Were you happy? Were you excited to be living?
No, I was depressed. I was on, not just because of this, but I was on antidepressants. I didn't have a social life. I wasn't doing anything, didn't go to movies or anything like that because I just didn't feel like it because of the pain.
Wow. And this has been going on for how long? How many years?
Well, I've had arthritis for 10 plus years.
Okay. Now, you came in here on January 25th of 2018. You received the care. Give me an idea. Has anything changed?
Everything's changed. Everything's changed. I'm a new me. First of all, the pain is minimal now. My doctor in March took me off of my fentanyl and my Percocet, which are narcotics. I'm now only taking Motrin. I'm sleeping all night, 6 to 7 to 8 hours even sometimes. I'm shopping and losing weight because I can walk. I've lost 13 pounds since January, which is awesome for me. Both my doctors, my endocrinologist and my family doctor are impressed and excited for me. But the most important thing that I can do, I raked my leaves at my house for the first time in 10 years.
In 10 years?
In 10 years, and my sister and brother-in-law have always done it, and I did it for the first time, and I even surprised myself. And then a neighbor drove by, and she did a Yui with her car because she didn't think it was me, and then she came back to say congratulations to me. So
wow, so the whole neighborhood was a
yeah, everybody sees the change because I'm out now, and I'm not in the house all the time, and doing my own everything now.
Fantastic.
Yeah, big difference.
Thank you for sharing that.
You're welcome.
Now, not everyone should come into our office for a consultation and screening. And what I mean by that is this. If you need to finance care and you know that you cannot afford $200 a month in your budget, now is not the time to do this. If you're looking for a diagnosis, if you're looking for a disability claim report, if you do not have chronic pain, there's no reason for you to go ahead and come into our office for a screening and consultation. However, let me say this. If any of these pertain, get screened as soon as possible. If you have knee, back, hip, or shoulder and neck pain for 3 months or longer, if you're looking to avoid surgery or joint replacement surgery, if you're taking pain or anti-inflammatory medicine on a weekly basis, if your sleep is being disturbed due to pain, if you have difficulty getting through the day, if you're unable to enjoy activities due to pain, and if you're ready to enjoy your life again, you need to call us and make the appointment for your consultation and screening so you can get the information and understand what your options are. So as a result of watching this video, here's a special offer we have for you. You can receive the consultation fee, which is normally $60. It's a discussion of your medical history. We go over your previous care from other offices, your current and past medications. We're going to include x-rays of the areas involved to determine the amount of arthritis, bone on bone that you may have. We're going to look at your expectations and compare your x-rays to your expectations. And we want to be able to determine if you are accepted for care for regenerative medicine joint care. On that same visit, we're also going to perform the chronic pain screening. Again, this is normally $250. This is where we check your range of motion. We do a functional pain assessment. You receive the myoneural validation test, and we discuss the reasonable expectations from care based on your specific results and findings. And we're going to determine at that time if you're accepted for care for the myoneural rehabilitation. If you're accepted for care, then we're going to be very specific and discuss the myoneural care as far as the number of sessions and frequency. We'll go over the regenerative medicine joint care. We'll talk about the types and frequency of the injections, and we'll go over the specific cost of care for the cash discounted fee, as well as through financing options for you as well. And again, this special offer is made available to you. We can offer this for you if you give our office a call in the next 4 business days, and we will go ahead and schedule you for this special appointment so that you can better understand what options are available other than drugs and surgery so you can get your life back in order. Again, I'm Dr. Roy Picard, and everyone here at Michigan Integrative Health wishes you nothing but the very best.